So welcome class, welcome to Samir Critic. So today we will basically discuss about the failure of implant. What are the failure we have to take care before implant or before design our implant, or how can we improve that, I mean, that the how can we improve our implant design such that failure will not occur. So there are some classification of the failure. So first is functional failure, next is materialistic failure, and third is the mechanical failure. So in case of functional failure, those in which desired effect is not achieved, but no frank defect is observed. Those in which desired effect is not achieved, but no frank defect is observed. Causes wrong device used, incorrect application, post-op infection, adequate post-op management. So this is the basically comes under the functional failure part. Next come to the material failure. Due to the problem associated with the devices, characteristic by the failure of material in devices, so this kind of materialistic failure will occur. So it can be occur due to corrosion. So corrosion is the one point of one reason for material failure. Another is the mechanical failure. So due to the error in the implant design, or some problem during the manufacturing process, so mechanical failure basically occurs. So this is also categorized into the three parts. Sometimes it is ductile failure, sometimes brittle failure, and sometimes fatigue failure. Basically fatigue means the repeated load with time, or the cyclic load with time. Repeated load, repeated or cyclic load with time. So now comes to the principle for actually those are the like any functional failure, material failure, or the mechanical failure. So those are the types of failure we have to take in care, but the modes of failure are something different. So modes of failure means why the failure occurs, why the failure occurs, failure occurs. So those are the basically the principal modes of the modes, and for that which kind of or which type of failure occurs, so that are those three: functional, material, or mechanical. So let's discuss the modes of failure. So first is the excessive deformation. So for excessive deformation or twisting action, so material can be failed. Some fracture, abrasion or erosion, and chemical attack. So there are something difference between abrasion and erosion also. Is erosion and corrosion also. Abrasion and erosion basically the same thing due to the mechanical phenomena, but corrosion is basically the chemical phenomena. So with two, the chemical attack. So this chemical attack also known as corrosion of the material. Corrosion. So broadly we can say deformation, fracture, erosion, and corrosion. So those four. So now comes under the what's happen when these modes come into the picture, and then how the material will fail. So first thing, whenever those modes come into the picture, so first thing what we observe, the instability. So during corrosion, erosion or tear, wear, during wear, so what is basically happen, the implant get loosen and it will unstable at that position. So inadequate implant, incorrect, sometimes maybe in the incorrect positioning of the implant is also responsible for instability, or insufficient bone support. So those are the another problem, and along with the modes of failure also responsible for instability. And what's happened during insufficient bones for support? So inadequate reduction will take place, defect will comes under picture, absence of cancellar bone graft weaken in bone taking place. Next come to the bone necrosis. So in case of bone necrosis, this is also ultimately leads to the bones cancer. Next, complication basically comes under local. In under local there is two complication like skin and wound reflection, and another is general. Basically this is the thrombo embolism. So some things like blood clotting as well. So basically we can tell that bone necrosis or the bone death is the condition of the bone when the bone tissue due to the lack of blood supply. So ultimately it can lead to a bone cancer as well. So patient of COVID-19 also prone to this kind of bone necrosis. So as the blood supply will stop, so the skins of the upper layer will look like that dark surface will comes into the picture. Now the most important and the most modes of failure will occur due to this corrosion only in case of biomedical implant. So corrosion is the granular degradation of the metal by electrochemical attack. So by electrochemical attack, and is concerned when the metallic implant is placed in the electrolyte environment of the body. So we have to take care of this definition. Next, intimation of corrosion depends on the pH and O2 tension at the implant side as well. Corrosion weakens the implanted metal, changes the surface of the metal, release metal ion into the body fluid as well. And the type of corrosion, in case of type of corrosion, galvanic. So there are few type of corrosion. So first is the galvanic corrosion, next is the crevice corrosion, pitting corrosion, fretting corrosion is mostly for these four are mostly important. Others otherwise stress, irregular and iron releasing also the one kind means type of corrosion process. But basically due to the ion releasing, this kind of galvanic corrosion will take into picture. So in case of galvanic corrosion, mode of metallic deterioration in which two dissimilar metal is contact with the another in the solution. So this is the test what we do when the implant is prone to galvanic corrosion. And there, so those are the test for different corrosional test. So this is called crevice corrosion, this is called pitting corrosion. So whenever we are going through to check any corrosion, so we have to going through this corrosional test as well, and so that we can know that how our implant is corrosion proof as well. And so just going through those corrosion, like in case of galvanic corrosion, mode of metallic deterioration and two dissimilar metal in contact of the one another are immersed in the solution. Next, what we do, a battery is formed, anode undergo more rapid dissolution and cathode undergo less rapid dissolution. Causes, use of stainless steel screw in the cobalt chromium plate when an impurity is accidentally included during the manufacturing, rubbing of implant. So this is the scenario of the galvanic corrosion as well. So in case of galvanic corrosion, this is the method of doing to check the galvanic corrosion and what happened. So this is mentioned here. So similarly, those things are also mentioned like crevice corrosion. A narrow gap is placed between the implant like screw head and plate. High concentration of Cl minus and H minus ion destroy this passive layer and local corrosion comes. So this can be a key point of crevice corrosion. Similarly, in case of pitting corrosion, localized reaction will start, defect the surface layer. Chromium, nickel and molybdenum are added to the stainless steel to resist this pitting corrosion also. So fatigue corrosion, in case of fatigue corrosion, result may vary, very small oscillation, movement and vibration, cause abrasive damage to the layer. In case of oscillating motion, so that is one kind of, we are going through oscillating movement or vibration to check the fretting corrosion, because I have mentioned that the time circle is very matter in case of fretting testing. So we have to going to check that fretting corrosion part. Next come to the stress concentration. So stress concentration are the very important part. So in case of stress concentration, high mechanical stress may alter the activity of the metal and rupture a protest passive surface layer, thereby increasing its susceptibility to corrosion. So that is the most important thing. Next হচ্ছে intragranular corrosion. If high impurity or aggressive aggregated between the grains of the relatively pure alloy, a localized galvanic cell may exist between the crystals and alloy in the grain boundaries as well. So this is what we call irregular intergranular corrosion, not irregular, sorry. So intergranular corrosion. So the abrasive between two grains. Next, ion releasing. So in case of ion releasing, implant metal release ion into the tissue. Oxidation, occasionally patients may be sensitive to chromium and nickel found in the stainless steel implant. This remember. So when we going for the chromium or nickel uh, coating, or nickel and chromium mixed with the stainless steel, so then only this kind of ion releasing process will get start. So now comes, and so those are the also the main common factor for failure of implant. So mostly corrosion and different corrosion. So not only corrosion, so implant failure also played a major factor due to the implant related. So broadly we can classify it into the implant related, patient related and technical related. So in case of implant related, we have discussed almost every modes, but sometimes patient related problem will comes and technical related. So in case of implant related, so an ideal implant should be chemically inert, non-toxic, great strength, high fatigue, low modulus of elasticity, good wear and tear resistance, and inexpensive also. And but sometimes that patient related problem will come into the picture. So like osteoporosis will cause, bone fat losses will come, unstable fracture. So after implant we have to take care the proper medicine, take care proper rest, or what doctor suggested. And sometimes few of the times very less than 2% technical issue will also take some major role in case of this kind of implant failure process. So those are basically as follows: excessive stripping of soft tissue, inadequate inflammation compression, early mobilization without adequate stability, inadequate bone support, failure to use of bone graft, scratches on the implant, improper placement of IM nail improper, and that's all. So basically those are the mm, brief description why the implant gets failure. So maybe it based on implant point of view, maybe based on patient point of view, or somewhat it based on technical issue also. So that's all for today. Thank you class.